I'll invite Dr. Divya Alex, Consultant Vitreoretina Services at Ahalya Group of Hospitals, for her video presentation on technique of intravitreal injection.
Good afternoon, everyone. I'll deal with the technique of anti-VEGF injection. So we will see a video showing the technique of anti-VEGF injection.
Intravitreal anti-VEGF injection. Pre-injection routine. It is suggested
Iodine 5% eye drops 1 hour prior to the procedure is as good as a broad spectrum antibiotic 3 days prior. Intravitreal injection preparations. Under all sterile and aseptic precautions, prepare a sterile trolley containing eyelid speculum, plate type, calipers, cotton-tipped applicators, cotton swabs, eye pads, povidone iodine 10% solution. Povidone iodine 5% eye drops are kept ready. The patient lies down on the operation theatre table with good neck support. Proper painting of the area is done with 10% povidone iodine eye drop is instilled in the cul-de-sac. Remove anti-VEGF from the refrigerator just prior to the injection. It should never be frozen, exposed to direct sunlight, reused between patients or used beyond expiry date. The kit contains a single-use anti-VEGF vial, 1 ml disposable, identified by purple hub, and a 30-gauge half-inch injection needle identified by yellow hub. Remove the cap from the vial and disinfect with 70% isopropyl alcohol and allow it to dry. Attach the blunt filter needle to the syringe. Then push the needle in the center of the vial stopper by holding the vial upright. The vial. Leave the filter needle in the vial and disconnect the syringe from the needle. Attach the 30-gauge injection needle to the syringe. Carefully expel the air from the syringe and adjust the dose to 0.05 ml mark. Do not void the injection needle. Intravitreal. Attach the blunt needle in the vial and disconnect the syringe from the needle. Attach the 30-gauge injection needle to the syringe. Carefully expel the air from the syringe and adjust the dose to 0.05 ml mark. Do not void the injection needle nor pull back the plunger. Carefully remove the cap from the needle without disconnecting it from the syringe. The syringe is now ready for the injection. Injection procedure. Ensure that the pupil is dilated for the procedure. Use sterile proparacaine 0.5% eye drops as topical anesthetist agent. The injection is preferably given under operating microscope. Apply the speculum. The patient is asked to look in the opposite direction from the site of injection. The most preferred site is inferotemporal quadrant, and so the patient looks towards supranasal direction. Prevent contact of eyelashes and eyelid margins with the injection site and needle. The site of the injection is at pars plana and is 4 mm posterior to the limbus in phakic eye and 3.5 mm posterior to the limbus in the pseudophakic and aphakic eye. Mark the injection site with the calipers. Move the overlying conjunctiva away from the injection site and also fix the globe with the help of a cotton-tipped applicator, which may be soaked with proparacaine 0.5% eye drops. Insert the needle with the bevel facing upwards towards the mid-vitreous. that is, the center of the globe. Insert the needle up to 1/2 to 2/3 of its length. The tip of the needle should be visible through the dilated pupil. Slowly injection site is pressed with the cotton-tipped applicator. Ensure that in solution. Check for vision, intraocular pressure and central retinal artery perfusion. Patch the eye for 1 to 2 hours. There is no need for prolonged patching. Avoid horizontal meridians at the injection site. While injecting, steady your hand by resting it on the patient's forehead or cheek. Can do eye massaging or AC paracentesis if required.
I'll just emphasize the points to ophthalmic microscopy as well as read the OCT, ensure the procedure to be done and mark the eye. It is always better to tag the hand also, like if you are injecting the right eye, tag the right hand, and you in the left, tag the left hand, and in the tag you can write the name as well as the brand of the injection. So emphasizing the use of 5% povidone iodine as Dr. Praveen has already explained, and usage of mask is a must both by the patient as well as the surgeon. Avoid talking while giving the injection as gram-positive cocci are the commonest infection following intravitreal injection and droplet infection may be the source. So in some anti-VEGF injection, it may come as the whole pack, but in some anti-VEGF injection, there may be only 18 gauge needle, so be prepared with the rest. So very important point is that when we remove the cap from the needle, the injection should be ready for, that is injection should be ready like to be injected at the side. So the problem occurs especially in the learning phase in the beginners. When you go to the injection site, the marking will be lost. So what you can do is, this is the Castrovecchio calipers. You can dip it in the povidone iodine and can mark in the area as 2 or 3 markings can be given, so that even when you displace the conjunctiva, the marking can be clearly seen. And always ensure that the tip and while withdrawing, to prevent the reflex, a cotton tip applicated dip in the povidone iodine should be applied to the withdrawn area. So post-operative care, the post-operative antibiotics, it's an area of debate, but it is the injector's choice whether to give or not. All patients should be given a discharge card mentioning the injection details, post-operative instructions, symptoms of infection, and a 24-hour emergency contact information. The patient is instructed not to rub or wash his eyes or have a head bath for at least 24 hours and avoid swimming for at least for 3 days. And the patient is informed that there can be floaters of bubbles for 24 to 48 hours. And this may be alarming as the patient removes the iPad from the home. There can be subconjunctival hemorrhage which can be alarming to the patient. So a word from our mouth will be consoling, and this make them understand that this will clearly go off within a 2 to 3 weeks time on its own. So the first post-operative visit, it should be within 3 days after injection. If the patient is unable to come for any reason, they can be asked to report to the nearest ophthalmologist if there is any unusual pain, redness or drop in vision at any point of time. And anterior segment examination should be looked for basically cells in the anterior chamber and the anterior vitreous, and the fundus also should be examined for any exudates, floaters or new onset peripheral retinal hemorrhages or vasculitis. Injection in both the eyes, it should be done at an interval of 3 days to avoid an increased level of circulating drug in the system. Thank you.
Thank you, Dr. Divya, for the very practically